More than just a sign of emotion, tears are an important part of the healthy eye. Without an adequate film of tears on our eyes, sharp vision is not possible. The tear film actually consists of 3 layers. An oily layer forms the outermost surface of the tear film, smoothing the tear surface and reducing evaporation of tears. A watery middle layer cleanses the eye and washes away foreign particles or irritants. An inner layer of mucus allows the watery layer to spread evenly over the surface of the eye and helps the eye remain moist. For our eyes to be healthy, we need not only the correct quantity of tears, but the correct quality as well. If there's an imperfection in any one of the tear film layers, then the quality of tears can be affected. The eye has 2 different ways of making tears. It can make tears at a slow and steady rate to keep the eye moist and comfortable, or it can also make large quantities of tears in response to eye irritation or emotion. Sometimes our eyes do not make enough tears, but at other times, the quality of the tears is not good enough to keep our eyes healthy and comfortable. These common occurrences lead to a condition called dry eye. Sometimes with this condition, the dryness irritates the eye and excessive tearing may occur. This is because the eye is overcompensating for dryness by producing too much of the watery portion of the tear film. However, the oily and mucus portions of the tear film may also be deficient, which can actually cause the dryness. Many people are perplexed when their doctor tells them that they have dry eye, yet what they see and feel is excessive tearing. The problem is not that there aren't enough tears, but that they don't have the correct quality of tears. For some people, dry eye can be a short-term problem brought on by an environmental factor, such as smoke or wind. For others, it can be a chronic, long-term problem requiring effective treatment so that vision or comfort is not affected. Symptoms of dry eye include excessive tearing, stinging or burning eyes, itching, scratchiness, stringy mucus in or around the eyes, excessive eye irritation from smoke or wind, difficulty wearing contact lenses, and brief or ongoing blurring of vision that may change with each blink. Chronic dry eye can be caused by a number of things. Age is one common factor, since tear production normally decreases as we age. Although dry eye can occur in both men and women at any age, women are most often affected, especially after menopause. Another common cause of dry eye symptoms is the use of prescription and over-the-counter medications, such as diuretics for fluid retention or high blood pressure, beta blockers for high blood pressure or heart disease, antihistamines, sleeping pills, anxiety medications, and pain relievers. Certain medical conditions, such as autoimmune diseases, may also cause dry eyes and dry mouth. One common autoimmune condition is called Sjogren's syndrome. Other culprits of dry eye symptoms may include blepharitis or rosacea, eyelid problems that affect the outer, oily layer of the tear film, causing natural tears to evaporate too quickly from the eye. Other more rare diseases may also affect the inner mucus layer of the tear film, preventing the natural tear film from staying on the eye. Your ophthalmologist is usually able to tell if you have dry eye by examining your eyes. Sometimes tests that measure tear production are necessary. One test, called the Schirmer tear test, involves placing filter paper strips under the lower eyelids to measure the rate of tear production under various conditions. Another test uses a diagnostic eye drop to look for certain patterns of dryness on the surface of the eye.
I was first diagnosed with dry eyes 5 or 6 years ago, but I really think I had it years before that. My eyes were bothering me, but I didn't put two and two together, so I just never even mentioned it to the ophthalmologist. And finally, when I did, then he diagnosed dry eyes.
Treating dry eye is generally accomplished by 3 methods: adding tears, conserving tears, and preventing tear evaporation. To add tears, eye drops called artificial tears are used. Similar to your own natural tears, these drops lubricate the eyes and help maintain moisture. Artificial tears are available without a prescription, and you can use them as often as you need them, once or twice a day, or even several times an hour. There are many brands on the market, so you may want to try a few of them to find the one you like best. Some people may be sensitive to the preservatives in artificial tears, so preservative-free eye drops are available. Also, if you need to use artificial tears more than every 2 to 4 hours, preservative-free brands may be better for you. Your ophthalmologist may choose to prescribe an eye drop medication containing an anti-inflammatory, such as cyclosporin. This medication helps to restore not only the right quantity of tears, but also the correct quality of the different tear films. Saving your eye's own tears is another approach to keeping the eyes moist. Tears drain out of the eye through a tiny opening of the tear ducts on the eyelid margin, called puncta, then through a small channel into the nose. This is why your nose runs when you cry. Your ophthalmologist may recommend closing off the puncta, either temporarily or permanently, using tiny punctal plugs. Punctal plugs can be inserted in the lower eyelid, the upper eyelid, or in both eyelids. Using punctal plugs saves your own tears from draining away and helps artificial tears last longer.
My ophthalmologist recommended that I use the artificial tears hourly and a hot washcloth on my eyes 15 minutes a night, and said that in the future, if that doesn't work and I'm not happy with it, he'll consider punctal plugs.
Tears evaporate like any other liquid, but you can take steps to stop the evaporation. First, a person with dry eyes should stay away from anything that causes dryness, like very warm rooms, hair dryers, wind, and smoking. When the indoor heat is on, keep a humidifier or pan of water in the room to add moisture to dry air. When you're exposed to the elements, such as wind and sunlight, wear wraparound glasses to reduce the drying effect of the wind and light. Some people with dry eye complain that their eyes feel scratchy when they wake up. This symptom can be treated by using an artificial tear ointment or gel eye drops at bedtime. Finally, for some people with blepharitis or rosacea, your ophthalmologist may also prescribe an antibiotic ointment, warm eyelid compresses, and/or lid hygiene to relieve your symptoms.
Yeah, what the ophthalmologist recommended certainly seemed to work the first month I did it. When I use the artificial tears, I think that helps a lot. I think the washcloth helps a lot. It's certainly better than when I don't.
While it is a common and uncomfortable condition, dry eye does not have to interfere with your lifestyle. Talk with your ophthalmologist about treatment options.